ਗੱਲ ਕਰੀਏ ਓਨਟਾਰੀਓ ਦੀ ਤਾਂ ਓਨਟਾਰੀਓ ਵਿੱਚ ਇੱਕ ਵਾਰੀ ਫੇਰ ਤੋਂ 548 ਨਵੇਂ ਕੋਵਿਡ-19 ਕੇਸਸ ਰਿਪੋਰਟ ਕੀਤੇ ਗਏ ਨੇ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਓਨਟਾਰੀਓ ਵਿੱਚ ਅਪਾਇੰਟਮੈਂਟ ਦੇ ਨਾਲ ਕੋਵਿਡ-19 ਟੈਸਟਿੰਗ ਦੀ ਸ਼ੁਰੂਆਤ ਹੋ ਚੁੱਕੀ ਹੈ। ਪ੍ਰੀਮੀਅਰ ਡਗਫੋਰਡ ਨੇ ਇੱਕ ਵਾਰੀ ਫੇਰ ਤੋਂ ਮੀਡੀਆ ਬਰੀਫਿੰਗ ਕੀਤੀ।
Today, we should all be proud of the fact that Ontario has completed over 4 million COVID-19 tests. More tests than all the provinces combined across the entire country. That's 4 million tests delivered through our 150 assessment centers, 77 pharmacies, long-term care homes, pop-up and mobile testing units right across the province. Last Friday, we announced updated measures to help our testing centers prepare for the colder months and build capacity for the second wave. Thanks to those measures, we have eliminated the long lineups. Folks who need it can now get a test by appointment. And this gives people certainty when it comes to testing. By working around the clock, we've also been able to reduce the testing backlog by 40% since last week. We now have 77 pharmacies offering testing, and this number will continue to grow. We're going to continue to invest in testing. We invested an additional $7.7 billion in healthcare during the first wave. We've gone from 4,000 tests in early April to over 40,000 tests a day over the last week. And now we're investing another $1.3 billion for testing and contact tracing through the COVID-19 Fall Preparedness Plan.
Ontario has established a strong foundation for testing and case and contact management that allowed us to rapidly identify and contain any outbreaks. When we first started testing back in late March, our province conducted 4,000 tests per day. By working with our partners, we are now well on our way to increase testing capacity to process 50,000 daily tests by mid-October and 68,000 daily by mid-November. And last week, the province hit a new milestone and completed over 4 million COVID-19 tests since the beginning of the pandemic. This is more tests than all of the other provinces combined. Our broad range approach to testing has helped us determine if and where COVID-19 was spreading. What we found was that it wasn't circulating widely in every community. This was an important learning that helped us make the informed decision to target our resources to those experiencing symptoms, to protect the most vulnerable, and support outbreak investigations. We continue to look at ways to provide patients with timely access to testing and results, especially as we enter into the cold and flu season. That's why we are investing $1.3 billion to enhance and expand efforts to test, trace, and isolate new cases of COVID-19 as part of our fall preparedness plan.